Hi everyone, Dr. Fink here. Today we'll talk about optimal timing for testosterone replacement therapy and how we can manage to keep our levels stable. As you know, testosterone is naturally produced in our body and it is constantly produced by our testes. So the hypothalamus in our brain tells our testes basically to produce testosterone, and then during the day we have several waves of testosterone, but usually at 8 a.m. in the morning we are the highest, and then there's some fluctuation going down at night, and then in the early mornings we go up again, reaching our peaks in the early mornings around 7 or 8 a.m. That's why when you get tested for testosterone, usually the doctor will prescribe a testing in the morning on a fasted, empty stomach. So this is the natural production, right? So let's say now we have low testosterone, we have to replace testosterone. The traditional way to do that is injectable testosterone cypionate or enanthate, which has a very long half-life, meaning that the drug will stay in our system for several days and then slowly release the drug into our system, and by doing so preventing us from the need to replace it like every day or several times per day. So if we look at the testosterone enanthate or cypionate and how it will react in our body. So if you have the timeline here, so time, and on the vertebral we have our testosterone levels. Let's say we have low testosterone, so we have, let's say 200 nanogram per deciliter. So we're starting here, and then on day one, here we inject, okay, injection. So now our testosterone here will slowly increase, and let's say on day 3, it will reach its peak. This is also dependent on each individual dosage, but let's say after 2 or 3 days it peaks, and then it slowly goes down, and around when we are maybe day 7, we reach the basic level we were before. Okay? And in this short time frame, let's say we injected 100 milligrams of testosterone enanthate or cypionate. So here we would be, also this depends on each individual, but just for an example, we might be at 1,000 nanogram per deciliter, which is almost borderline superphysiological. So meaning it is almost too much, okay? And this, let's say 800 would be our normal levels. So this is between, let's say 5 and 800, it's where we want to be. So probably in this time frame, maybe 1 to 2 days, we will be in a supraphysiological level, meaning we will be probably above 800 for a couple of days. What this implies that during these 2 days, we will be prone to side effects more than during this phase where we are in the physiological normal levels. Okay, so this is the danger with long-acting injectable testosterone, that during a certain time we possibly overreach and be going into these super physiological levels above 1,200 nanogram per deciliter, which are basically telling our hypothalamus and pituitary gland, oh, we have way too much testosterone, we have to completely shut down our own production, and this leads to infertility, etc. But it can also increase very much the aromatase activity. So aromatase is an enzyme which is converting testosterone into estrogen, and estrogen is healthy to a certain degree for males, but when it goes too high, estrogen also has side effects such as gynecomastia, for example. It's the growth of breast tissue, female breast tissue in males. And this happens when testosterone is too high and aromatase activity is too high. Also, testosterone, when there's too much of it, can also be converted into dehydrotestosterone via the 5-alpha reductase enzyme, and this can cause baldness or acne. So those are all side effects we want to avoid, and in order to do so, we try to maintain our testosterone in the goal level. And it also depends on each individual, but I will recommend, if the starting point would have been 200 nanogram per deciliter, to be in a healthy level, anything between 4 and 800 nanograms per deciliter. It's where we probably would see the least side effects, but still have some good effects of the testosterone plate therapy, because we have to keep in mind that when we were too low, we had the effects of low testosterone, which is it could be a low libido, depression, loss of muscle mass, even cardiovascular complications. So we need to address that, of course. But I think the level in between 4 to 800 is the range where you want to be to just maximize those effects without having side effects from high testosterone. So we have to counteract the side effects from low testosterone with testosterone replacement therapy, but we have to make sure that we don't go overboard and cause new side effects from having too much testosterone. So how can we basically avoid this peak and this super physiological levels? Let's say we're injecting every week, once per week. So why don't we just take half? Let's say we're injecting 100 milligrams per week. Let's say we inject once on Monday. So we just inject half, 50 milligrams. So we will reach a peak again, but it will not be as high because the dosage is just half. And now we're going down. And on, let's say, day 4, we inject again, and we go down. So by doing so, we have less supraphysiological testosterone levels, and we're keeping a more balanced testosterone level. Here I should have made it a little different. So after day 4, we probably don't go all the way down, so we keep it a little higher and go up again. So as you can see, if we keep with that injection protocol, we are basically in the optimal range between 4 and 800 nanograms per deciliter. So we avoid these downs after 7 days where the low testosterone symptoms may arise, and we also avoid these high peaks where the symptoms of high testosterone may arise. So for injectable long-acting testosterone such as cypionate and enanthate, to keep levels stable and to minimize side effects, I would say that injecting more than 1 time per week is better. I mean, we can also inject 3 times per week, but then we are also talking about having more burden of injection sites and pain of the injection. So I think twice per week is pretty is a good compromise between those injection protocols, and everybody should see good stable testosterone levels without having too harsh side effects. Okay? So this is a different story for the very long-acting testosterone preparations, such as testosterone undecanoate. The levels are more stable and they don't fluctuate like this. And also orals or creams or nasal sprays, which are very short-acting, and I will go into those in a separate video. But I hope this was clear and you could understand how long-acting testosterone, cypionate and enanthate work, and how to optimize the injection protocol to maximize the effects with minimizing the side effects.